Hi guys, welcome to my channel and welcome. If you're new here, my name is Sissy. If you're a returning subscriber, welcome back. Today I'm very excited to bring for you a very special guest. It's my favorite sister.
Only sister.
She's also my only sister, and here she is. I thought today I'd have a conversation about motherhood in Uganda and the UK. What's it like for us, because we are both mothers. Can you believe it?
Can you believe it? Yeah.
We are now in the village.
The last time we're both here, I think
I was
you were a
I was a
bride.
mother. No.
Oh no.
It was your it was your quinjo.
Yeah, it was my queen.
And I had only Gabi at that time.
Oh yeah.
But we'll be talking about how when we were younger, we used to, whenever I would come to the village, we'd have to first mop the house, with she, housework, washing dishes. Do you remember how when we had to wash dishes, then now one person had to wash, one has to rinse.
You have to book in advance. Like for me, I'm rinsing.
But now we are mothers. We have the some respect.
Yeah, there's some respect they give us.
When you
I
come
can't believe
home.
I'm in the guest room.
It's good to go old.
But it's shocking, because you keep expecting them to call you.
To go and wash dishes.
Yeah. You keep expecting them to call you like, hey, please, you've over-relaxed.
So anyway, so Kemi here has just recently had a baby, so she's a nakawere.
I'm a
Congratulations.
Thank you.
So her baby is just 1 month now.
Yeah.
5
weeks.
Yeah.
Now, yeah.
And how's it going? How is mom life? Second time round.
Second time round. Let's see. Second time round is actually not so bad as the first time. The first time, my goodness,
First time. Tell us below, are you a first time mother? How are you? And we pray for you. If you're a first time mother.
It was horrible because I remember it was COVID time. It was COVID time.
That makes it extra.
My mother-in-law was going to take care of us. Then that day she gets COVID. The day Mona is born, she gets COVID. At home, mommy has COVID. Everyone has COVID.
It was a tough time.
Yeah, so on discharging us, we have to go home. Just me and my husband and this little
baby
thing that we don't even know how to change diapers at that time. It's just new. We kungared, I'm telling you.
I'm surprised actually. It's so similar to my experience, which I wouldn't have expected in Uganda. Yes, because even us, it was just us two and Gabi when we went back home.
Oh my God, it was horrible. We kungared, and then I had pressure. I had high blood pressure, and then I think when I was like 1 week, I got COVID.
You also got COVID?
I also got COVID.
Maybe you had it also.
I don't know. I got COVID. Ronnie was the one who was taking care of me, taking care of the baby. And remember I had C-section.
You had C-section. So even you deserve to be taken care of.
It got too much, and then I was sick. And then we had no help. We had no maid at the moment. It was just me and my husband. I would, in the evenings, I would take a walk. I would take like walks, and I'm like, God, why me? Why me? Because I felt like I was going to die. I actually felt like I could just drop dead and die. The pressure was high, the COVID high. Every night we are up all night, all day. It got too much.
Did she have colic?
No, she was a calm baby. That's what helped us. She was a calm baby. But of course, they're up all night.
Yeah.
I would take walks. Everything, it feels grey. I'm just there like, what's going on? What's going on? Like, I didn't know it was called postpartum depression. Like, I didn't know I was
you feel like you had postpartum depression?
Yeah, I feel, now that I look back, it was horrible. Because I was just walking and I'm like, what is going on? What is going on? You walk and you don't have direction. Like, I'll just take a walk and I don't know I'm going to stop. Yeah, I just come back.
That sounds serious.
Yeah,
that sounds so tough.
Yeah. I didn't tell you this.
No, it didn't sound that bad, I think.
It was so horrible.
Yeah.
It was so horrible. And for that 1 month, I think the only person that came to help us.
How long did this feeling last?
I'm thinking the intensity of this whole thing is usually in the 1 month. Of course, even afterwards, but that 1 month is critical because you're trying to keep yourself alive. You're trying to keep the baby alive.
Yeah.
You're trying to balance your mind.
Yeah.
Like, you're a first-time mom. It was so much. It was so much. It was so much.
I wish you could tell us about what I want to know is in terms of your expectations and now that reality you faced. What were you expecting? We've got, obviously, we have baby here now, but I was just, as we wait for you to settle and you continue the story, I just wanted to tell people why we might even be talking about this. And it's in relation to the last thing I asked, which is expectations and reality. In terms of expectations, for me personally, I don't know about you, before I was a mom, I never even thought about it. But even when I was pregnant, now I'm thinking about it. I used to watch lots of vloggers, the Imami influencers, mostly the ones on YouTube. They were all, for me, they were all in the UK. One of them is called Mrs. Emily Norris and others. But they were so positive. They would just show, like they do newborn routine. Then they show themselves dressing the baby. Everything looks so calm, so nice, happiness, joy. But then they would say, oh, the baby was up, but wasn't so bad. Like, they wouldn't tell you that.
Like, would that be their first child?
No. All the powers following.
They need to say that.
That's the truth. But they said it. It's just that me, I assume there's a difference between
you
your third.
Assume,
So
between
when you're watching,
first, your second, your third.
So when you're watching post stories, you should take that into consideration. Or even sometimes you may meet someone, who I have met some people who for them is so good. Baby sleeps, I feed him, he sleeps. Why else should you cry?
I mean.
Then from like 6 weeks, they're sleeping all night. There's such people like that.
Yeah.
Where their babies are like that. So if you end up meeting only such people, then for you now, you don't have that same experience.
Yeah.
You may feel like there's something wrong with
going
you. Or
oh my
there's
God.
something. So that's what happened to me. Is that for me, I was only seeing that positive experience. I had no expectation that can go any other way.
For me, actually, I don't think I had any expectations. I didn't see beyond the 9 months. No.
Because the pregnancy itself is so stressful anyway.
It's so stressful.
It's so all-consuming.
And of course, like, you know my story. My anxiety with this other with Mona's pregnancy was on a high. So for me, I was looking mostly to finish the 9 months. Yes. And so I didn't look beyond that. I didn't know. I didn't know there is a journey.
You didn't know Katandika Butandisi? Yes.
I didn't know Katandika Butandisi. Pregnancy is just the easiest part.
Now that you've mentioned, even me, the little research I did, I was talking, it was all about birth.
Yes.
It was all about labor. As if when labor happens, who knows what will happen?
You walk out of the hospital. They give you your certificate and you go home. No.
That's all I was thinking about. All my preparation is on labor,
it's never like,
techniques.
What do we do after? How do you change pampers? How do you deal with this? How do you... No, like, for me it was mostly, has the baby moved? Okay, they've moved. Count your kicks? Okay. Now, hospital, you need these bags, you need to pack this, you need to pack this, you need to do this. But it's never beyond.
I loved watching hospital bag videos.
Yes. I think you even have one. Do you have one?
I also have one, so you can go and have a look at my hospital bag video. I was just all in there. That excitement, anticipation.
You're in that anticipation of, oh my God, you're going to come back with a baby. Like, it's positive vibes of like, I'm coming back with a baby. Oh my God, you're going to have a baby. But this baby that you're seeing in your head are these cute babies on Instagram. Like,
they're not even newborn size.
They're not even newborn size.
In your mind, you're imagining a 6 months baby, I think. I remember asking, this baby is so tiny.
With a cute outfit. But no.
They can't even fit in anything.
By the time they wear those cute outfits, they'll be like, how old? Like 6 months? And at that point, you're so over it.
Yeah. So we're not trying to discourage you people, but we're just trying to give a balanced view. Because we think people need to know to prepare yourself. So to prepare yourself.
Yes, for me, my expectations was I'm getting my baby and we are going home and we are going to be a cute family of 3 years. I take pictures, you know.
Which we did. We did take our pictures, brother. We take your pictures. Make sure your camera is charged. You don't want to miss your newborn pictures.
Cute baby girl, you know. I didn't look beyond. I did not look beyond. So I reached the hospital. I remember the first shocker was the hospital first giving me a list of what to bring. I think they put gloves, they put make sure the baby comes with a basin, a mosquito net. I'm like, why do we need a mosquito net? Why do we need a basin? Why do we are going to bathe the baby from
Why do you need a
home?
basin?
Yeah,
They make them bathe from here.
Yeah. The hospital that we use, they require like a long list.
It's like
Even
going to
olive
school.
oil.
Nah.
Yeah, olive oil. Olive oil, basin, gauze, what. But you never really think. You're just thinking, oh, this is cute. Yeah, who's going to do all this work? You're just going to give birth. I mean, full stop. So we go. On reaching, we give birth. The good thing is that I was talking to you, and I feel like talking to you helped a lot. On that first day, they bring. Oh my God, the pain from the C-section.
Okay. But do you understand what a C-section is? They have
people usually think it's the easy way out. It's not.
Can you imagine being cut up to inside?
7 layers. 7 layers of pain.
I think it's the most painful wound I've ever had.
It is. It has to be. No, it has to be the most painful.
And you know another thing?
It really has to be.
People have varied experiences. Don't just go by us, but it's just good to know various options. Because some other people are like, it wasn't that bad. But at the same time, I feel like some people over there, I think they're trying to convince themselves.
Yeah. Yeah. I used to think, before I gave birth, I used to think actually the C-section was the easier option. Yeah, you're like, you just lie there, they remove the baby and you go home.
It's harder. It's harder. It's hard. Both are hard, but
it's
for
really
me.
hard.
For me, I went into labor for Gabi, and it hurt a lot, but it would stop. The contraction pain is not constant, like a wound pain. It comes and goes. It comes and goes. Gives you a break, and once you push, it's gone. The contraction pain is gone. You'll be sore down.
Yes,
but it's not
but for like a short while.
Yes. So the healing as well. So if now the next thing I was going to ask you is, first of all, we thought about how bad it was, but to give people hope that it wasn't like that forever and never. Amen. At which point did you start to feel you can see the light at the end of the tunnel? Or when did things start to turn around for the first?
At what point? During the postnatal period?
Why are you still waiting? We're talking about the first baby who is now nearly 2, 1.5.
No, 2.5.
Sorry, 2.5.
Almost 3. You see, it almost felt normal. I think like at 2. I think 2 years is when you start. For me, that's when I started coming back to myself. And then that's when I realized now I'm pregnant with. Oh. So like,
no sooner have
you healed
than you're back into it.
So I would say 2 years. But now with this one, I don't think the period will be that long.
It won't.
I think the shock.
So when we say that, I wanted to ask that if you knew now, if you knew then what you know now, what would you do different? But that question, I think you can answer it in that, how is this current postpartum going? What's the difference?
You see how the first one was horrible, like horrible. Okay, not so horrible. Let me not over-exaggerate.
Even me, it was like, let me just add on to my bit. My first postpartum experience felt like a nightmare.
It was a nightmare.
I felt like I was living in a nightmare.
Yes, and you're not waking up.
And it's not ending.
And you're not waking up.
And the days all blend into one, like morning, nights,
what? Did you used to dread the nights?
Yes,
like,
the nights were the worst.
For me, I would see the sunset, and I'm like, shit, it comes again.
The nights were the worst.
Comes there.
Because for me, I was staying with Edward only, but the whole night, Gabi cries, and we don't know what to do with her. We pass her to me. Then we went to visit Uncle Frank's and stayed there with them. And in the daytime, they would help you because they are people, but at the same time, in the daytime, you don't need so much help because the baby is sleeping. Most of the time, they are asleep most of the daytime. But at night, no one can help you because they have things to do.
No one can help, exactly.
So there was that loneliness as well of being you alone in your struggle in the night.
The first postnatal period, like I didn't know I was in depression. I didn't know until later on. I'm like, my God, I almost died. Yeah. Christine came to help. I remember Christine came for a week, but that week felt like a month. That week, like I'm so grateful. You know, 1 week for postnatal period is like
it makes a difference. So whatever help you can get,
she came helped for a week. Then we went to Makerere when Mona was like one
to your in-laws'
1 month.
place.
Yeah, to my in-laws' place. To my in-laws. They helped. We went there also for a week. The moment I reached like this, I just blacked out. I remember blacking out like, you guys hold the baby. Let me just, because it was marathon. Like me and Ronnie, it was just marathon. Then the moment, the reason I say this is because even with the help, I remember even with their help, they will still bring you the baby. Like they will still, you still have the same amount of sleep. It's not like.
So it's the difference between you and me or us who are in the UK who don't have help, is that even when you have help, there's still a point where the help will stop.
Yeah.
Yeah.
It's not like they're going to
It's
hold
not
the
like they're
breast
going to
for you.
breastfeed for you, unless you're bottle feeding. Unless you're bottle feeding there, they can do it.
I remember I pumped Co. I pumped Co so that I could sleep for long. I slept for 30 minutes. They said, no, Mona has finished the milk. Come and feed. I saw her they're bringing the baby. And I'm like, no, please, I've come. After that, I was like, you know what, guys, just give me the baby because I'm going to stay up waiting for you guys to bring me the baby. So just put... So even if there is help, because I feel like it's in the other areas of like cooking for you.
Oh, yes. Oh, of course. Because now, us here, where we are in UK, you have to do everything yourself. Like, imagine. Because paternity leave is 2 weeks.
Like you did that with Edward.
Lucky me, I did not. Because, I mean, I did with Edward, but for me, he didn't have to leave for my other pregnancies. He's there full time. But you see other people whose partners are working, they have 2 weeks paternity leave only. And then you have to go and do everything yourself. Someone has had this section, but let's say you have other kids, you still have to take them to school, bring them back, cook, this and that.
This
There's
time
no added help. Most people can't afford nannies.
This time my husband only had 2 weeks.
So second time round, is it better?
This is better.
Tell us now, and what
better.
can you advise
If I knew this earlier, I think even now that I know it, I would have more kids, but no, I'm not going to. But I feel like the experience is better right now because we knew what to expect. We knew what to expect. We knew that you do not just joke with your mental health like that. You do not just joke. So from the hospital, we got help from that day when I was going for the C-section. The nurse came, the bedside nurse. There's a company that deals with these.
They have nurses.
Postnatal, the postnatal home care basically. So from there, she was helping at the hospital because at the hospital, so you need help.
Yes.
You know,
Yes.
And no one tells you that. You think maybe the nurses will do a lot of it, but mostly they just come to inject you, to check on your pressure.
Yes, you need someone there
and
with
walk out. Yeah.
Yes. You need someone with you because even remember when you've just been operated, you can't even reach.
You can't even
you can't reach the baby. You can't, you know. So for us, they allow the husband to be there from the operation room, and they are there with you. It's the only place where they allow. Other places they don't allow bajanjabi, unless adults, where adult patient, they don't allow bajanjabi except in postnatal, where they allow the husband to be there.
This time round, it's easier.
So ask for as much help as you can.
From the get go. We've had the bedside nurse. Up to now, we still have her. And a maid.
As well, yes.
Who is taking care of the other baby. So that, you don't feel like you're ignoring your other child. And for me, I feel like that would have eaten me up. Knowing like, she's not...
So that's our experience, us who don't have maids.
Don't you feel like some guilt?
For what? For
like
not having the attention for them.
Now like Jojo.
Yes.
When you're concentrating on Micah.
Yes, because because first of all for me even Jojo was breastfeeding. So when I came back from the hospital, imagine I'm starting breastfeed one she also wants. It was difficult because then she had to learn to take her turn. So it was a hard adjustment for her because all along she had me to herself, and now suddenly I'm like pushing her away. Then get it. because I have a wound. She's trying to jump on me. I can't lift her.
And imagine, my other motherhood, imagine even in that period, you still feel guilty. For me, imagine even in that period where you can't do anything about it.
I felt bad.
You still feel bad.
I felt sad.
And yet there's nothing much you can do.
No, nothing much. And you know, for me now, what happened, what made it worse is that because I was breastfeeding both of them, I didn't have the support from the other parent. They kept wondering. The other pool is Edward and Daddy and Mommy because they were there. I think they were like, oh, am I crazy? Like, just stop it.
Like, just stop already. It's that easy.
So, but what made me breastfeed for long? I had this feeling that Mama, she's still a baby. Bambi. She was 22 months by the time the first one, the third one was born. So I had that feeling, Bambi, let me just keep breastfeeding
Bambi,
her.
the middle child.
Yes. So I continued breastfeeding her until, but it was so tough because that adjustment of tandem nursing, both of them, and they all want you at the same time.
That's exhausting.
Yes, but it still continues. And now, my eldest is now 6 years old. And that period
Congratulations.
is way in the past. So whatever you're going through out there and you feel like, will this ever end? It will end.
It will end, Bambi. It will end. It will end.
It will end. And you'll go to other challenges, but also other joys.
Other joys.
Because there are joys of having a conversation with your child.
There were small joys. There were small wins during the day. Those hugs they give you, like there were small joys that come with it.
And
so.
take the pictures.
And take the pictures.
Because even now when they're little, when they're newborn and they're crying all night, in the day they're usually sleeping. Take your pictures.
Take your pictures.
Because also time moves slowly when you're in it. But it moves quickly in the pictures. You're like,
it does. You mean?
Good.
Exactly. Because now, like, if I'm to look back at this one's picture, this baby's picture, like a week ago, it's different from now, right?
Yeah.
It must be.
So take a lot of pictures. Get as much help as you can. And
get as much
share your own
help.
experience and tell us.
Please don't feel guilty to get help. Please don't feel guilty at all.
But another thing I wanted to ask actually is about your mental health and you're feeling depressed and back then. Like, how bad did it get?
You see, I've come to realize, I feel like most people who are depressed don't know they're depressed until it's too late. Yeah, until they're like, shit, I'm depressed. And I feel like that's where...
So what made you realize that maybe now you're depressed? Because someone might be watching and they may be thinking, is this me?
Yeah. I would cry a lot. I would cry a lot.
You were sad.
Irritable all the time. All the time. I'm irritable. And then it's like you're in a bubble.
But a cloudy bubble.
A cloudy bubble. Yeah, like a cloudy bubble. You think... Actually, the world gets grey. Like, it actually gets grey. I feel like now, it's constantly like this. Like, it gets constantly like this. Even if the sun is shining, for some reason...
The funny thing is, to me, this is bright because UK can be grey. Yeah. This looks so nice, bright. But I see, for Uganda, it's because the sky is not blue.
But it got like this constantly.
And it's true.
And I have to keep reminding myself, I love this child. I love this child. Because you tell someone, there's also that guilt of why am I feeling like this? And yet, you know, I'm blessed.
Joy.
Yeah. You should be over the moon. You should be taking pictures. You should be,
blessed.
Of
which you are.
People are telling you congratulations,
Yes.
But you're feeling some sort of way. You're feeling like your mind has gone.
Yeah.
I don't know if that is just adjustment pains. I don't know what that is.
No, it sounds like some depression postpartum. Yes.
You take walks, you come back, nothing has changed.
So in the end, what actually helped? What do you think? Was it just the passage of time, or?
I went to the gym. Remember, I started working out like
at 4 months.
At 4 months, I told you. Yeah, I think that was missing. You know what? No.
You took your own life in your own hands.
Yeah, I went to the gym. They told me, no, it's too early to work out. Come back like at least 4 months. I'm like, okay. And then I did a diet just to feel like I'm getting, because I'd gained, I gained so much weight. So much. Where I couldn't look at myself in the mirror. I would look and I'm like, what is this? And it's like during breastfeeding also the weight increases. Over how?
Because we eat a lot.
Over how?
Me, I think it's because I don't know. Well, don't say give you too much every time they're giving you porridge and what?
I used to take a flask of porridge every night.
I think that was a problem.
They misled me. Mboma nange take as much porridge. Nyo bushera. Twenda mashereka. As if I'm going to feed like as 5 babies. So the size. So I was like, you know what? I'm going to take off this amount of money. I just sacrifice it and they do keto just for my mental health. And I feel like it was mostly mental health, not even physical. Just to feel like, okay, I'm getting back to myself. Again. Yeah, I'm getting back to myself.
Because that's another thing I think that causes sadness postpartum, which I feel like is almost...
Weight gain.
Sudden loss. Feeling like you've lost yourself. I think it's something that would cause sadness in anyone postpartum, which I feel like is almost normal, honestly. Yeah. Because who is not losing themselves in this process? Losing themselves? I can't imagine. You're not the same. There's something that you're going to lose. Yeah. There's something. Yeah. There's something that you're losing.
You're going to sacrifice something. You're getting something, but you're sacrificing
you lose your time of just Netflixing and chilling.
Those things.
Your whole life.
Just being.
You can
just getting up and going for a sleepover. Like, okay, I'm going for a sleepover. You can't do that anymore.
Yes. So there's a loss of a part of yourself.
You can't just sleep.
That's the sadness.
You have to make sure the other person has first slept. They're comfortable before you can sleep.
So that change, honestly, I don't see how you can stay normal.
And you know, and I feel like it's worse. It's worse. The postpartum depression is worse for people who give their all. Like, you know, those people who are perfectionists. I feel like for me, I was a perfectionist in that first pregnancy, where everything has to be right. Everything has to be right. I don't know.
No, I get it. Because if you are someone who likes things to be a certain way, and always it's worked out for you,
it really
now you throw a baby into the mix.
Oh my God!
You can't keep up.
You will.
So your whole world just has gone upside down.
Yeah, it drained me for like a good 1 year until now. I've just let go of Mona. Not so much, but I'm like, do what you want. But then
I was trying to be so controlling.
I was there, like I have to be. My past traumas I can't transfer, but they are just like 5 months, they're 5 weeks. You can't transfer your traumas on a 5 weeks. But then I'm there like, no, I have to be the perfect parent. I have to feed them properly. I have to wake up. I have to bathe them every time. I have to... No.
You set such unrealistically high standards for yourself.
For yourself as a parent, especially in those first weeks. Really, the child is they've just come out, they don't know what's going on. Just try to keep them alive. For me, I was all over the place, buying clothes, what. Yeah.
Because some of these things, I think you just have to live through them. Because we'll tell you, but unless you've been through it. If you've been through it and you understand, tell us below. Because there's that feeling of someone has actually got it. Because for me, I feel like I started to share my story on various platforms about my first postpartum experience and how it was so bad. Because I never saw anyone else. I had never seen my story anywhere whereby I've not enjoyed it. Can you imagine? Yes, I never saw it. So I was
like, you're wondering, for me, why am I not enjoying it? Huh?
Yes, I never saw it. Because anyway, I guess I was following not the wrong people, but different people. The algorithm was, I overfollowed a certain type of account, and so they were showing me certain things.
Oh my God.
So...
Do you know my mental health? You also helped. You.
Thank you.
Yeah, you helped.
How?
Apart from the gym, of course, praying. I felt like,
Jesus,
praying.
take the
yes,
wheel.
Take the wheel, please. I can't.
Jesus, take the wheel.
You were one of the people. Yes, because you would call in. Imagine, we never used to talk much. But then for some reason, you were that voice that kept saying, come back, come, you're okay. Yeah, that happens. That's normal. That you would call and just give me those things that I want to hear. Like, do you also wake up at night? Do you also do this? Do you also... I'm like, yeah, I do that. Like, that's... She's like, and you're like, that's normal. That's normal. No one has ever told me that. For me, I never used to think... So you would tell me and I'm like, okay, maybe I'm not mad. I'm not mad.
I think that's why I did it for you. And any other mother I've ever talked to, if you're postpartum and I know you personally, I always ask specifically for any negatives. Because no one asks you.
You really
and
helped.
Yet
No one ever asks.
They don't ask you the negatives and you're not going to be upfront about it. Because you're not sure. You have that shame also. for feeding them in the first place. So you don't want to say. So at least the main reason I was sharing my own story was because I wasn't seeing it anywhere, and and I felt like another reason I would even ask other mothers who are going through it like you is also to also validate myself and my own experience and see that it wasn't just me. Because you know how annoying it is to ask someone.
I wish I can do that for someone one day, because
you're doing it now. Please tell us, has she done it for you?
I really don't know, but
yeah,
you did it for me. Because I'm trying to think of someone who did it. You did it for me. You did. Most people, they never really, they're not concerned about your mental health. It's mostly like, have you eaten? Please take some rest.
Yeah.
But okay, how am I going to rest? My brain can't shut off.
Yeah.
You know.
Or even the baby. There's some friend of mine was telling me that no one asks about them, they ask about the baby.
Exactly.
Like you've forgotten. It's like your envelope.
You forget.
And they've discarded you, sort of.
There
was that feeling as well.
There was that feeling.
Yeah.
Where your phone call would make my day. Because I would be like, oh, thank God she has called. Because now at least I can say something.
Yeah.
I can say something.
And say how you feel.
Oh, yeah, exactly.
The
how
truth.
I'm feeling.
So talk to a mom out there.
Please do. Reach out.
Especially if for you your experience was positive.
And please reach out to talk to them about their experience, not your experience.
Yes.
Like, don't just call and be like, for me, Pananga, this is what happened. No. In that moment, Bambi, you're still in their grief.
Yes.
You're still you're still in their depression. Yeah.
It's not about you.
It is not.
You go and talk to someone
else.
Go and heal.
First go and heal.
Go and talk to someone else about how you're feeling. And then come and ask someone who is in it how they are feeling.
Yes. Because now you're there in your things.
Yeah.
They come to the room and they're like, for me, and even this time I had preeclampsia.
You've been through the most.
And the person comes and tells me, the person who gave birth like 5 years ago, they're telling me about their experience. For you're fresh in it, you're there in it. They're saying, Nange, for me, this is what I did. Nange, for me, I was like
unsolicited advice.
Oh. Unsolicited advice.
I think it's almost compulsory, but please try and resist. Because all of us, even you don't, you see someone and you feel like,
and you feel like you want to something.
You wish you could tell them, please. Just don't.
Please don't.
Because another thing is that someone already feels unsure of themselves in this new role they've been thrown into. Their confidence is not all that there, yes.
We are all not born mothers.
But then now you come up and start, because your unsolicited advice, every time you give someone advice, they didn't ask you. It's actually making it seem like they don't know what they're doing.
Exactly.
You're saying, you don't know what you're doing.
I'm better than you.
I'm the one who knows
I'm better
what
than
you should do.
Basically.
So,
no.
So anyway, when they call.
And please check out, let's look out for each other, especially the mental health. For me now, every time I see a mother that has given birth, I don't concentrate on the baby, because the baby is fine.
The baby is even fine.
The baby is fine. Concentrate on that person that has just birthed. Concentrate on that one. They are the ones that are going through the most. Yeah.
So I think, I guess on that note, we're going to have to end the video. I didn't ask you a proper introduction of yourself. Why we do that now at the end? Who are you anyway? I'll be talking to.
I am Rita. I'm Sisi's sister. I have her favorite.
Yeah. Who I love very much.
I'm a mother. Oh, I love you too.
Do you know, Kemi, I love you so much.
I love you too, imagine.
Do you know, when we were little, I don't want to cry. When we were little, I wanted to go with you to school every time.
I remember.
I wanted to go with you to school.
I remember.
But I wasn't allowed.
I've loved you for my whole life. It's just that life happens.
Yeah. Yeah. In the video with Mommy, she was telling me about, I did a video with Mommy. I always like looking out for my siblings.
Oh, God.
I feel like I did. I guess apparently since I was a baby,
and then something about you. We've always assumed you're okay.
Me, of which I mostly have, except when I wasn't.
But like you're also human, I feel like we've always assumed that you're fine, even from childhood. Yeah, because of course you were the.
But I wasn't always 100%.
Of course you have, but then no one has ever really wondered, like, are you
Didn't
okay?
know I had depression when I was a child.
Really?
Yeah, self-diagnosed, which we're not recommending. I had depression. I was depressed. Yeah, when I was around 6 years old. Yeah.
I didn't know that.
Yeah. So I've made a video about how I healed from my childhood trauma, which you can watch up there if you want. But in that video, in summary, I was talking about my sexual abuse in childhood and how it affected me.
There was that.
Yeah. So now, I think I was depressed when I was a child. When I was about 6 years old, I used to have nightmares, and I used to be in that experience that you're describing, where life is like gray.
Yeah, and you're a child, so you can't really.
I couldn't put words to that feeling. Yeah. That's why looking back is now I'm saying that was depression. I was so sad. I would wake up and I'm even sadder. I was in P1. Because I remember I was in P1, I'll come back from school. And I did ask mommy one time on the phone, I didn't ask her the video, that wasn't there a time when, because I was like, if a child is depressed, someone around should have seen.
Must notice. Exactly, they must see.
So she said that, she noticed that I did look sad and she didn't know what was wrong. She also didn't know. Ignorance is not always bliss. She also didn't know what to do about it or what.
No.
But you know, depression can pass.
It can.
By itself.
Bambi, yes, please, hold on. It will pass. Whatever you're going through will pass. Because to be honest, I don't want to grief jack you, but I think I was also going through it. I was also going through it, but I don't know when it started and I don't know how it went, but that's a story for another day. Yeah. So anyway, the depression, even when it burns out, like even without treatment or what, it can just end. But if you feel like you're not okay, ideally you don't want to wait for the end, because what if instead you become worse and worse? You look for the help. So for me as a child, I did have depression, I think, from my own self-diagnosis of what it was like. And I remember the day it lifted. When did it lift? One day. Like I remember there was a day where they got us. I was from waking up from either one of my nightmares. Every time I would have a nap, I hated sleeping. Every time I would have a nap, I would go into the same nightmare. It was a nightmare where like I'm on a slide or something and I'm going down, 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 and I can't stop, and it was so horrible. Oh my God. Yeah, and then they woke us up, and then, because they used to force us to have naps in the afternoon, and then we went to Joy's. And that's when the sexual abuse started. You think? For me, that's when it started, because I remember I told you about mine. I don't know if it happened at the same time. I told you about mine and you went and reported mine. But I didn't report mine. You didn't report yours. That's why I'm saying, like, we've always assumed you're okay. Yeah. And up to now, you know, sometimes I wonder, like, are you okay? Because you're always watching out for everyone. Yeah. I think I'm okay. You're okay? Yeah. I'm okay. I'm learning to love myself and do things for myself, because also I tend not to do for myself, I tend to do for other people. You really do. Yeah. You really do. You're that selfless. And Edward is teaching me that be selfish. He's always talking about how I should. I've forgotten how he says it, but you know he's so funny. Wait, what are you saying? What are you doing? You're buying shit. I know. Look about yourself. Let me tell you guys. Sissy came. Of course, she's our auntie from London. She came with a whole suitcase for this baby right here. A whole suitcase. But it's no big deal. For me it is. For me it is. No one really does that, I want to tell you. For you may see like it's something. Because you do it. You do it willingly, but people don't really do that. It's my joy. I'm so happy to do so. People don't really do that. Yeah. So anyway, you got me this cup, and you're so Isn't she selfless? Huh? So, Bambi, like, I can't. For me, I've always loved you as a child. Always. I did. I wanted to build you all the time. I remember. Even you know, I came to Nangongo. Really? Yes. No. I came to Nangongo because I wanted to be with you. Oh my God.
funny thing is you, yesterday Edward's mama was asking me about Namagunga. She thought I was there for Edward, but I said no. I went there up to S because I wanted to be with my sister.
Oh.
Yes. I did.
I don't know when I stopped feeling that. Like, I don't know when I stopped feeling like, because I felt like you became so independent at a certain point, and I felt like you didn't really need people. Like, you're that Miss Independent, Miss, yeah.
I don't know.
Oh,
I don't know. But anyway, when I was in S5, that's why I came to Namgunga because I wanted to be with the same school as you and have that experience with any other sister. Yeah, because I like to have a sister.
Yeah.
I even wanted more sisters. But we don't know of any other sisters, Manange.
I
Don't
hope they are
shock us, Manange. We don't know you. So,
but
yeah.
you're amazing. You're an amazing sister. An amazing sister. And you took the right career.
No.
Honestly.
This can be helpful for me because I'm in a career kind of dilemma. I don't know what to do next.
That course that you're taking is good.
Psychiatry.
It's good.
And psychotherapy because I want to do medical psychotherapy, which is talking therapy really for people. But I don't know if I'll get it. It's very competitive, and there's only one place in the whole county.
You'll get it.
Yeah, I will.
Honestly, yeah, you will.
From your mouth to God's ears. We'll see.
You're the most intelligent person we know. You'll get it.
Anyway, thank you so much for coming. I'm sorry, I hope I didn't trigger you.
No, man. No.
For yeah, let us know below what was your experience. I think some of the things we've talked about, they need their own video.
Oh yeah, they do.
Because I didn't plan to talk about them. So
they need their own video.
Maybe we should consider that.
We should plan for another day before you go.
If you like this video, give it a thumbs up. And if you want more videos from us, from me, make sure you're subscribed. Bye.
Bye-bye.